Welcome. My name is Sani Sarah Nachireja Emanuela. Um, for my second born, the second pregnancy, I looked for it. I wanted it. My husband was not ready, but I kept on praying to God to help me get another child because they had told me after the ectopic it would be hard for me to get pregnant. So I kept praying to God to bless me with a child. I still had that pain of losing my child, and miraculously I wasn't feeling well. I kept checking every month. And every month my periods would come, so I'd be disappointed. So I got pregnant again after like 4 months, 5 months after the ectopic. I get pregnant. I had even given up. By the way, I think the reason as why most women don't get pregnant is because we become anxious. Once you're anxious and you're looking for a pregnancy, you tend not to get pregnant. Because when I wanted the pregnancy, I failed to get pregnant until I gave up. I'm like, but my husband is not in a rush to have a child. My husband is not asking for a child from me. It's okay even if I don't have a child. I mean, I will try for a child later. So I stopped trying and I concentrated on my work. After 2 months, that is when I'm not feeling well. I'm not feeling well. I tell my husband I'm not feeling well. So he tells me, go to hospital for a check. So even when the doctor told me, could you be pregnant? I was like, I can't be pregnant. The doctor was like, can we check for pregnancy? I was like, no, there is no need. So the doctor just insisted, like, just as a by the way, because I had done malaria, typhoid, all other tests, and they had come out negative. So I was like, okay. So on trying, oh my God, test came out positive. I was so excited. I was so happy. And the doctor told me, since you have had an ectopic, please go do a scan. Now, our medical team needs to work on itself because when I go to a scan, I went to some hospital still, I will not mention the name. The radiographer tells me it is an ectopic pregnancy. After I was 7 weeks pregnant, and the dude tells me, you have an ectopic. I recommend you go see a gynecologist and they do an operation or they remove it. Oh my God, I was broken. I was shattered. Because this guy had asked me about the scar and I had told him I had an ectopic. It was at 5 weeks. It happened like 5 months ago. So I expected him to give me the news in a better, calm way. But giving you the news, he was all proud. He didn't even care what I would feel. He would just tell me, you have another ectopic at 7 weeks. Oh my God, I was broken. I got out of the room. I sat down. I couldn't believe it. I was like, okay, I'm dying with this pregnancy. I'm not doing another operation. I call my husband, he comes, he picks me. So we call my gyno in Mulago, and she told me she wasn't available, but she told me she doesn't accept that it's another ectopic. She's like, how far along are you? I'm like, 7 weeks. She's like, no, I don't think it's another ectopic. However, go and do another scan for a second opinion. But driving from, actually I was in IHK Kororo by then, driving from IHK, because we had decided to go to Ntinda, Kampala Independent Hospital, but that was the longest journey me and my husband had ever taken. I just sat in the car and I told him, you know what, honey, you're losing me because I'm not undergoing another operation. I am not losing this baby. So we went. Oh my God, that doctor, that lady, she was, I don't know what tribe, what other country she came from, but that Muzungu doctor, she was so good. She did a scan. She told me, no, it's not an ectopic. She showed me the baby. She's like, the baby is here, the baby is okay. And I predict it will be a boy. Oh my God, the lady was so sweet. But she told me, however, there's some little blood in the uterus with the baby. So I'm going to give you Dufaston. I'm going to put you on bed rest. You have to come every week for some injections. And I had to take weekly medicine, Dufaston weekly, Nospa, and some other drugs for the baby to stay in for a period of 3 months until the baby was out of danger. Oh my God, I appreciate that lady. She had a complicated name. I failed to get her name. but she walked that journey with me. And then with time, I also joined Dr. Joseph Nsenga of Bethany Hospital. He also walked that journey with me. And there was also another guy. I had a number of gynos. There was also another gyno called Sempeo, Herman Sempeo. He was also good. Why did I have a number of gynos? I had pain. I would get pain that they would not know why I have pain. When you have that pain, the stomach is paining, you're not bleeding, the baby is okay, the scan shows the baby is okay, but you're just in pain. So we had to visit a number of gynos to get to know why is my baby acting that way. I would be in and out of hospital.